Welcome to More Than Miles, the podcast where we use storytelling and expert interviews to widen the lens on what it means to be a happy and healthy endurance athlete. We believe that athletes are so much more than their body, sport, and training miles. I'm Dr. Kate Edwards.
And I'm Dr. Kacy Sinders. We are endurance athletes, physical therapists, and huge coffee addicts. We spend most of our time treating, educating, and working with endurance athletes. Thank you so much for tuning in today. Now let's get to the show.
Hi, everybody. Welcome to More Than Miles. Today's guest is Dr. Courtney Gleason. She's a non-operative sports medicine physician at Emory University. She has a special interest in understanding female athlete attrition in sports and working with and for female athletes to optimize performance, minimize injury, and keep them active and playing the sports they love. Dr. Gleason is also particularly interested in bone health, bone stress injuries, overuse injuries, and the concept of relative energy deficiency in sport.
Hey, Courtney and I could have talked for hours on this topic, and it is a really, really good one, so I hope you guys enjoy it. We spend most of our time talking about RED-S, or relative energy deficiency in sport, and changes that occur with menopause in particular. So I hope you guys enjoy this one. We're looking forward to continuing to talk about female athlete health and how to keep you guys out doing what you love.
Hey, Courtney, how are you?
I'm doing great. Thanks so much for having me.
Yeah, thanks for coming on. We're really excited about this conversation today.
I'm excited too. Thank you. Been looking forward to it.
Courtney works with us, and she is a sports medicine physician at Emory. So we often refer to her with many of our athletes, but especially our female athletes. And that's why we've asked her to come on the show today. So I want to dive right in and ask you a few questions about you and your career. And the first one is, why did you choose to be a sports medicine physician?
That's a good question. I think there were a lot of things that contributed to my decision to go into sports medicine. I love sports, so I've been kind of active all my life. I played soccer and basketball growing up. I've gotten into tennis more as an adult. I enjoy just recreational running. And so it's a big part of who I am. I really think that it is sports medicine in particular. I really like it because I feel like it's a way of really supporting people and doing what they love. With the female athlete population in particular, it's actually a way of empowering people. And so those are a lot of the things that have contributed to my decision. I love what I do, so it was a good decision.
Well, we are sure glad that you are treating female athletes because it is a very specialized area of medicine. And I think it's becoming even more specialized as we actually have some research coming out about it and people are paying more attention that there's differences in male and female physiology. I remember when I was trying to decide what I wanted to do in college, I was really interested in orthopedics. So I definitely thought about the medicine route before the physical therapy route. And something I learned in my research was that it's very rare to have female orthopedic doctors. So I was wondering, what's it like to be a female sports medicine doctor, and how is that being a female in the field shaped your experience?
You know, interestingly, it is much more heavily male physician oriented. As with all things, females are starting to kind of make up more of the population for the sports medicine physician population. But yeah, it's still very heavily dominated by male physicians. And I think that one of the things about being a female sports medicine physician is for female athletes, you know, kind of having an opportunity to see a female physician if they want to. Because I think that in some instances, understanding the female athlete mindset or how you respond to an injury or something, I think that there might be something to that for some athletes. And so I think it's really nice to have that opportunity as a female athlete, just to maybe connect on a different way with the physician where maybe there's a different understanding where you're coming from. So I don't know if that answered your question. Remind me of the other parts if I didn't answer everything.
Yeah, you got it. That's perfect.
I think you got it.
Okay.
Yeah. And we were talking before we actually started recording about all the many things that we all have on our plate, actually, and some of the really cool stuff that we're doing. And you're the director of Emory's Female Athlete Program, and you've also put on the Women's Sports and Wellness Conference for the last 4 years. So That's really incredible. And I know I feel really honored that I've been able to speak at those conferences with you for the last 3 years, because this will be the fourth.
Right.
But tell us a little bit more about that and what made you start some of these things.
Gosh, let me think through a good answer. So to start with the conference, to me, I think when I think about the conference, I really think about the community that it promotes, both within the healthcare providers and the profession itself, with all of the women who have so much to offer from the professional standpoint. It's a conference where it's all female speakers, or has been up to this point. And so our first year, I think we had maybe 25 speakers. Our second year, we had 35 speakers. Last year, we had 45 speakers. And so this year, we just have to keep growing. It's just been so gratifying, because to really be able to see and hear and, work with all of these women who have so much expertise, and everybody, the conference is really multidisciplinary. So there are physicians, and there are physical therapists, and there are athletic trainers, and there are sports dietitians, and there are sports psychologists. And so everybody's really coming together. They're really excited about being a part of it. And so from that standpoint, getting to work with all of the people who are part of the conference is really just so amazing. But then all the people who come, all the people who attend, and we've had to do the conference for the last 2 years has had to be virtual because of COVID. And we've had people from last year, we had people registered and attending from 22 different states. I know. So it's just grown, and it's really just coming from a place of wanting to provide information and support women in, their athletic endeavors. And people are, really of all level. So you really may have amateurs and people who are professional athletes, people of all ages. So we try and kind of cater to adolescent athletes, collegiate athletes, athletes who are into midlife and beyond, and all of that. So we try and really find ways of including everybody and providing stuff that's, helpful and important for across the gamut. So it's been just such a great thing to be a part of. And even within our department at Emory, a lot of the female physicians and physical therapists have been involved with it. So it's been a nice way of kind of bringing people together in that way too. And then with our female athlete program, we have 5 total sports medicine physicians within the Emory department. And everybody kind of has their own little niche and kind of specific things that they're interested in really kind of exploring a service that they're looking to provide for female athletes. So it's just really nice to work with the different providers, and we're growing. So it's a fun thing to be a part of.
Yeah. I remember that first conference. It was so much fun getting to know all the different women in sports medicine in various ways. And I really remember thinking, wow, this is a very powerful thing to be a part of. And then having the women who are attending the conference come up to you afterwards and, thank you for being there. And I remember one of my slides said postpartum is forever, because that year I spoke about postpartum runners, and one of the athletes started crying and was like, oh my God, I never realized that. And so, yeah, I think that conference is great. And I'm so glad you started that. Is there anything else you're working on that you want to share?
Before we go on, I do want to thank you. You've been a huge part of the conference. You have. You've been one of the keynotes a couple of years. And so, yeah, you've been super supportive. So I appreciate that.
Yeah, absolutely. I love it. I think it's awesome.
Thanks. Well, like I say, you've been a huge part of it. Other things that I'm working on. I'm actually doing a study that I'm super interested in. I don't know if I've told you about it. It's an adolescent female athlete study looking at reasons why adolescent female athletes quit playing sports. Because there's been some data out that there's a huge percentage of female athletes who discontinue playing sports in that kind of high school age range. And when you look at numbers compared to their male counterparts, it's significantly higher in female athletes. So across the board with male and female athletes in that time frame, you see that there's a lot of attrition just generally. But when you really break it out into specifics of female versus male, it's significantly more noticeable in the female athletes. And so I'm doing a study. It's just a survey study trying to really understand the factors that contribute to that. And so that's the first part of the study, is just to really understand that. And the ultimate goal is to hopefully gain some understanding so that maybe we can implement some changes to support that population and being able to continue in their sport if they want to. And part of the motivation is we know, again, through past research and other data, for young women who play sports, there are innumerable benefits, both socially, academically, long term. From a health standpoint, there are just so many benefits to women and young women playing sports that if we can find a way to maybe support them in, staying in their sport, that's sort of our ultimate goal. So I'm super excited about that. So we are about a year into kind of collecting surveys and all that, starting to get some data back on that. And then we'll go into our second phase with it.
That's really exciting, Courtney. I didn't know that.
Yeah. And then we're also doing a multidisciplinary clinic. So we started that actually during the pandemic. It's a multidisciplinary clinic for female athletes, really of all ages, but a lot kind of main focus on high school and collegiate athletes, primarily for athletes who have bone stress injuries, but also other overuse injuries, delayed healing from various injuries, or even somebody who's just, had injuries in the past and really wants to focus on injury prevention. So currently it is myself and Val Schonberg, the sports dietitian. So we are doing that a couple times a month together. And we have some other support from our adolescent medicine colleagues within the pediatric department. So we're working on building that too. So it's exciting.
Wow. I think that's a great transition into our next topic.
Yeah, so we're going to go ahead and switch gears and talk a little bit about RED-S, or REDS, or formerly known as the female athlete triad. Our listeners who have followed the podcast know that this is a topic near and dear to my heart, and it's something I want to continue and grow in my practice and really learn the best way to help people and help, particularly young girls and women get through these types of situations. And I can't think of anyone better to learn from than you, Courtney. So our listeners might not be familiar. So let's talk about what RED-S is and why it changed from the female athlete triad.
This is a particularly interesting topic for me too. So I know we share that interest. So that's something that sometimes we work with patients together who have, or we suspect, RED-S. So just as a little background, so the female athlete triad was sort of the introduction to all of that. Female athlete triad was, kind of from the 1990s, where it was recognized that there was some interrelatedness between kind of nutrition and fueling, along with bone health and hormonal health and menstrual irregularities, and how they all kind of connected to each other. And sometimes there was a predisposition for bony injuries if there was prolonged underfuelings and prolonged estrogen deficiencies with menstrual irregularities. And so for a long time, there was a lot of research and learning about the interrelatedness of those three things. And with that came kind of a broader understanding of how underfueling may impact even several other physiologic processes within the body, as well as kind of an understanding that it also can affect male athletes as well as female athletes. The underpinnings of RED-S, so relative energy deficiency in sports, is for the level of activity with an athlete, if they're not fueling enough to really support that level of physical activity, in addition to all of the basic bodily functions that you need energy for at a baseline. If there's kind of a chronic state where there's not the energy to support that, then you can start to see any number of injuries or any number of conditions.
One thing I want to tie together for listeners is RED-S, or relative energy deficiency in sports, can affect injury risk in general. And so it's not only bone health, but I want to make this tie for people why bone stress injuries and RED-S, or formerly known as female athlete triad, are always so closely connected.
Yeah. For bone health, we know that there are many things that contribute to bone health. So there are, we kind of categorize things into, intrinsic factors and extrinsic factors affecting bone health overall. In athletes, the proper nutrition and proper fueling is one of those intrinsic factors that really support good bone health. So that's one of the things with the connection between RED-S and bone health. So chronic underfueling can lead to problems with having lower bone density. And lower bone density can lead to an increased risk of having a bone stress injury, because if you have the same amount of stress going through a healthy bone versus the same amount of stress going through a bone that has lower bone density, then it doesn't take as much to have an injury to that bone that has lower bone density. Additionally, with RED-S, we also know that there's a huge part of bone density and bone health that's related to hormonal health, and particularly to estrogen. And so estrogen is very important, and estrogen levels are normal in, if you look at a woman who is eumenarrheic, that means essentially that they have a normal amount of estrogen, and that normal amount of estrogen supports a normal bone density. And so in prolonged states where some athletes will not have a menstrual period for, 3 months or 6 months or 12 months or longer, then they're in this prolonged state where they have low estrogen, and that can really lead to problems with low bone density. So in a combination where there's low fueling and hormonal dysregulation, which we see with secondary amenorrhea, then there's a setup for having low bone density. And that's really a problem for having recurrent bone stress injuries. One of the big things is, there are a couple factors with bone stress injuries. Number one, they keep athletes out of running or out of their sport for a long time. So different than a lot of other injuries where, as you get better from a symptomatic standpoint, you kind of progress back. With a bone stress injury, oftentimes it's just a certain amount of time you have to be out because you have to let the bone heal. And that takes a period of time. So that's one thing. It's a long time out from a sport. And then the second part is with bone stress injuries is a lot of them are recurrent injuries. So over 20%, up to 30% of bone stress injuries are recurrent. So if an athlete's out for 6 weeks, 8 weeks, 12 weeks with a bone stress injury, and then the next season they get another one, it's really a lot of time out from their sport. And a lot of, if we're looking at runners, for example, or dancers or other athletes who may have an increased risk of having bone stress injuries, or that we may see them in more commonly, oftentimes those injuries are happening towards the end of the season, just with all the important meets coming up, because it's a matter of, it's an overuse injury. So they're happening as the stress accumulates. So as the season is ending, and they're coming up to states and regionals and all of those most important meets, then, that's sometimes when we're seeing the injuries. So they can really be devastating. So we are trying to just understand more, how do we really support female athletes and male athletes too, but particularly talking about female athletes today, how do we really support them to remain healthy so that they can keep doing what they love? Number one, and if they do get injured, how do we understand what's going on best so that we can ideally help them from re-injury?
So what are some of the symptoms and things that you'll hear in clinic with someone who is suffering from RED-S?
I think that, one of the things to know about RED-S is that it can present in different places within the medical profession. It may be that they first present and maybe somebody in the physical therapy clinic maybe sees them first and picks up on some of the maybe risk factors or symptoms or something like that. Typically, when they come in to see me, usually it's because they're having pain someplace. They may present with a concern for a bone stress injury. So that's typically how they're coming in, and I'm seeing them initially, but that's not always how they initially present. That's just, what they're coming into clinic for. The way that I start the workup is we identify that they have a bone stress injury. So that's kind of the first thing that will be a little bit of a red flag. And so when I see somebody in clinic who has a bone stress injury, I actually have a bone stress injury questionnaire that I have them fill out. And so that goes through, it's like a 6-page questionnaire that talks through all of the risk factors of things that may be contributing so that we can have a sense of whether RED-S may be a factor. Because there are other things that can cause bone stress injuries, so if an athlete has not run cross country before and they're starting high school and they haven't run it all over the summer and they get going with their cross country team and go from running 0 miles a week to running 30 miles a week, that in and of itself can be a predisposing factor to a bone stress injury. So in that way, we may not need to go through a huge Red S workup in that way, if we can really identify, gosh, this was just really a huge increase in their training load very quickly. So we do the bone stress injury questionnaire so we have a sense of those risk factors. What's the menstrual history like? Has there been a period of secondary amenorrhea? What's their dietary history like? What's their dieting history like? What's their training regimen? What medications do they take? What other medical problems do they have? What's their family history like? Do they have a family history of early osteoporosis or people with low bone density in their family? So it's a very comprehensive questionnaire to get a sense of how much do we need to be concerned that this is a Red S picture where it's going to be more helpful for them, for us to treat it in a more holistic way than just say, oh, this is the bone stress injury. Let's just get you better from that. And then, those are the athletes that are at risk for being back the next season with a repeat injury. Because if we don't understand all of the risk factors and all of the contributors, and we don't treat those, then if they just get back to their sport, they'll likely wind up with a re-injury.
Yeah, and I love that. And I love how your process is so multidisciplinary, because I think if you don't pull in all of the other people, the perhaps sports psychologists or dietitian or PT that they're working with, or if you don't pull all those people in, or their coaches and their parents, then you really can't get the full picture and you can't really help them.
Yeah, you can get them better for a period of time, with rest for a bone stress injury. But if you don't look at more of the broader picture and then you just send them back, then a lot of times you see them back with a new injury.
So what types of labs or tests or what kind of diagnostics do you order when you have someone, let's say maybe this isn't that person who went from 0 to 30 miles a week, but you definitely suspect there's some sort of energy deficiency going on. So what sort of markers do you look at for those kind of people?
So a lot of times we'll use the bone stress injury questionnaire to finalize any labs that we want to do. So we certainly do some screening labs if we have a suspicion of Red S. And then sometimes we'll consider something like a DEXA just to look at bone density. But lab-wise, just as I would say, if we just had to totally generalize, what are some things that usually would be part of a Red S workup are things like a CBC, for example, really look at anemia. If there's some anemia, usually we'll look at a ferritin level. We usually look at thyroid. Part of the screening is you want to make sure that there's nothing else contributing. So you want to make sure that they have normal thyroid function, for example, but you also can sometimes see little subtle abnormalities of some of the thyroid hormone in Red S. So, looking at a couple thyroid indices can be helpful. You like to get a sense of their vitamin D. Bone health and vitamin D is super important. Oftentimes we'll look at a chemistry just to make sure that, all of that's normal. We'll do some hormonal labs, again, kind of based on the questionnaire. It's a little bit harder to do that and interpret if, for example, an athlete's on birth control or, so you want to kind of really tailor the labs that you decide to get based on the individual. But oftentimes we'll look at things like estradiol and LH and FSH, if that's going to be helpful in trying to identify what's going on.
What about treatment? So when we're talking about, okay, so this is what we look at. We found somebody who we definitely think fits into this Red S category. And I understand that it's individual for everybody, but what kind of treatment would someone expect to go through if they were diagnosed with something like this?
Yeah, it's really a team effort with treatment. You kind of mentioned this a little bit before. From the musculoskeletal standpoint and purely the bone stress injury standpoint, sometimes it can be, it usually involves a period of time out of their sport and out of high impact. And how long that is really dependent on a number of things, kind of the extent of the stress injury, where it is. There are different locations that may need more time. Sometimes, there'll be a short period where they may need to be in a boot if there's a metatarsal stress injury or a tibial stress fracture, something like that. So sometimes walking boots, sometimes crutches are important if there's a femoral neck or, if there's, a concern for compromise of the integrity of the bone structure. So we've got to get them to heal from the acute standpoint, got to get them to heal their injury. It really is important to have a sports dietitian involved and really make sure that from a fueling standpoint, if there's just some underfueling because of a lack of knowledge of the importance of kind of fueling up to your level of activity, And that's, can be very helpful for the athlete to kind of gain that knowledge. Sometimes there can be some disordered eating, and it's good to identify that also. And oftentimes the sports dietitian is very helpful. Sports psychology is super helpful also. And just, if there are areas where it helps to support the athlete in that way. Physical therapy is essential, getting the athlete back and rehabbing back from their injury, but also looking at, are there, and you guys do a lot of this, gait analysis, and are there other biomechanical risk factors for their injury? Everybody has their areas of expertise. It's important just to kind of know who is part of getting this person better and preventing them from coming back with same injury. But also other medical professionals, endocrinology can be very helpful. GYN can be very helpful. If there's, a history of secondary amenorrhea, then all of the, different medical specialties can be helpful in that way.
I don't think there's categories of this officially in the literature, but so there's definitely an element of some people just not knowing that they're under fueling, and then other people who are dealing with eating disorders and psychological component. I think there's a psychological component no matter what, but sometimes it's a matter of knowledge and other times it's a matter of mental health and things like that. And I actually was part of a panel talking about Red-S and sharing my experience with it and everything like that. And something that really struck me as I was talking with, these brilliant researchers and these ladies who are like pioneers in treatment for this, we talk so much about the knowledge and the physiological part of it, but unless you can address the psychological and the mental health aspect, if that's a big driver, which it was for me, a lot of these things don't quite matter. And I think that's when things get really, really messy. Again, I don't think you can categorize this group versus that group, but I just wanted to speak to the psychological component that make sure that's not deleted from this conversation because it's really important.
Yeah, it's hugely, it can be one of the biggest factors, really. If there's an athlete that actually lacks the knowledge and lacks, the information about their level of activity and how much their body's requiring to support their level of activity, then a little bit of teaching and education goes a long way. But there are a lot of instances where there, like you say, there's sort of more of an intentional component to it. And so really having a team that can really help support that athlete. And it is a process, a lot of times it's a process just to even bring them to the understanding that being a part of their injury and being a part of re-injury. So it's just part of it for sure. And it can be a longer process of just gaining the trust of the athlete and their families and having the right team, with people who are versed in treating and helping people and athletes who have more of the disordered eating component to it.
And I think that it helps to have a team that understands, Kacy is a great example. So she's somebody that really understands what it's like to go through something like that. And right. I think that a lot of people that have gone through disordered eating end up helping other people. And I think that that's why the multidisciplinary team and having a group of women behind you is very helpful when it comes to women. Of course, it happens with men as well.
Agreed. I think having some experience with that, it's just, there's nothing like kind of bringing that piece. It's an intangible that you really bring to the table when you're working with athletes and treating patients, that really the importance can't be overstated. It's super, super important that athletes feel like that you can relate and that you're not, just there to preach, but really there to help and support. And that, in some ways you've been there and you understand it.
Yeah. That's allowing your vulnerability out so that you can help people more. Right. Yeah. Which is something that's not across the board in sports medicine. And it's something that I think is really a great thing is when sports medicine physicians or physical therapists or whoever can be open and vulnerable to help their patients.
Right. Right.
Yeah.
I bring it up with almost everybody, or not everybody, but definitely, it's something I'm open about. And usually that's my window in and how I can ask more questions. The last big topic or kind of part of Red-S that I want to talk about is amenorrhea. Not to share too much of my own information here, but for me, for example, I didn't get my first, natural period until I was 21, which is super abnormal, and then kind of on and off until 2017. So I've really only been eumenorrheic for, well, actually we're going on 5 years now because it's 2022, which is really crazy. let me tell you, I'm a believer in your period as a superpower. And so I talk about it all the time because I remember in a former life thinking that if I did get my period, I wasn't working hard enough. And I don't know if you've heard this report from athletes as well, which is ridiculous, but it's still something I hear from college and high school athletes in particular. And I think we all are familiar that amenorrhea is a primary symptom of these things going on in energy deficiency. But I want to know, where on the spectrum does this occur? So is someone going to lose their period after they've been deficient for a long time? Or is this something that is more the first symptom that occurs?
Yeah, that's a good question. And I guess I have a couple of things that I just wanted to sort of comment. I think that you bring up a really good and important point of discussion to talk about the culture in sports sometimes, and kind of how a high school or collegiate runner, a lot of the information that they get is going to be from their fellow runners, and, what's normal and what's not normal, and even support from the coaches and sort of the whole athletic environment. And so I think that understanding our need to educate in that environment too is going to go a long way. And I think we're still kind of figuring out what's the best way to do that. I don't know that we've sort of mastered that yet, but I think that, that sort of idea, oh, if I get my period, I'm not working hard enough. I mean, where that may not be said sort of in, every sort of sports team or something like that, but there are sometimes people will say, well, that's just normal. You're a runner, so you don't get a period, And so I think first, really educating people that that's not normal, that that's your body's way of saying that something's off, and that, you need to get a regular menstrual period. So I think that's super important, is to really bring that to the conversation. And how do we change that culture or change that narrative a little bit within certain cultures, that may be the message that people are getting, because then they actually don't seek medical treatment for it. They just think it's normal. Everybody, that just happens with runners, or that just happens with an athlete who's super competitive. I think that's important to address, and for us to kind of, as a community of providers, kind of how do we best address that? So I think that's sort of a conversation to continue and think through and all of that. So that's part one. And part two, so, with the question about when does kind of menstrual irregularity show up, I think it's a little bit different for different athletes, just because I think it's just a little dependent on what your body's set point is. And so I think it's hard to say, well, gosh, if you've been amenorrhea for 3 months, then you're definitely at this point within the Red-S picture. But I think it's important just to say it's never normal to not be getting a normal menstrual cycle, if all else is normal. Again, it's important to also note that there are other reasons why you can have menstrual irregularities, and there can be other medical reasons for that. But when we're talking just specifically about it in relation to Red-S, it's really never normal to not have normal periods. And so the thing to know, I think what I could say about it is that most typically something like secondary amenorrhea in the setting of Red-S is going to be in advance of more significant bony manifestations. So that's, and not always, but the hormonal health is a little bit more responsive on either end. Whereas like when you start kind of fueling again and you're fueling up to your level of activity, menstrual regularity comes back sooner than bone health. So, it can take up to a few months as you normalize your energy support. It can take up to a few months to see normalization of menses and hormonal regulation. Whereas from a bone health standpoint, it can take a year or longer for that to kind of respond in the same way. So I don't know if that answers your question. I don't know that there's a specific way of saying, gosh, you're at this point if you've, with 3 months of secondary amenorrhea. But when you look at things like hormonal health and bone health, all things that we know related to Red-S, certainly the hormonal component to it will respond sooner with energy restoration than bone.
Yeah, awesome. Thank you. And yeah, addressing the culture around this is like my mission, and I've decided it's my life's work. So I appreciate you acknowledging that there's a lot of work to do, because there is.
Well, and you just added something to what we're calling the whiteboard for me. with
I
that.
saw that pencil out, Kate.
That
like
pencil
that.
is out. Yeah. So one of the big,
huge.
don't be surprised if you get a phone call.
I like it. I'm in.
It's now part of a bigger project I'm working on.
I like it. Yeah, it's super important. I mean, yeah, when you really think about talking about risk factors for things like bone stress injuries, actually the culture is one of the things that we can really intervene with and make sure that people have a good understanding. So I like it.
I think that's true about everything. And so when it comes to, especially with the running culture, we've been in this, and Kacy's heard me say this a lot, but I really feel like we have to kind of switch the paradigm and the messaging around what it means to be a healthy athlete now. Because we used to live in this kind of idea of, just do it. And now I think that is over. And we've learned so much about physiology, about hormones, about how psychology plays into everything, how our mental and our emotional state play into everything, that we have to change the culture now. And it's people like you that are really on the forefront doing this. And so thank you.
Thank you guys. I mean, we all spend a lot of time with these athletes. You guys see them on a regular basis. You really form relationships. They trust you. They know they can talk with you. And so I think it's really everybody, it's really everybody who's working with athletes that has the opportunity to impact it.
I agree. Well, I would like to switch gears, and we've talked about Red S, but now I want to talk a little bit about menopause, because that's another topic that a lot of our listeners and female athletes deal with. And I think it's another one of those topics that's been ignored for a long time because people didn't understand it. And also perhaps there weren't as many athletes that were going through menopause because of the attrition that we talked about earlier. So I think the first thing I want to kind of have the conversation about is, how does an athlete know that they're even kind of approaching this time period in their life? I mean, I realize now I'm not there yet, but I'm 41 and I feel like I'm 20 something. And so you kind of forget that your body changes and that you need to make changes in how you perform and how you fuel and how you exercise because of these changes, especially if you think you're 20.
Right. I mean, it's great to feel 20. This is the ideal. Yes. Yes. So that's good.
You're so young and hip, Kate.
I know. My hat says it all right now. If only people could see me.
So are you asking more like in the kind of a physiologic standpoint? How do people know?
How are people going to, if people that are not paying attention to signs and symptoms, who really don't maybe recognize what their body is telling them, how can they be tuned into the fact that maybe this is something they're getting close to and might have to start thinking about how that's going to impact them as an athlete?
Yeah. Yeah. I think, the effects of some of the hormonal changes, and so starting to notice some of those things. And so it really may be, in noticing some changes in kind of your normal menstrual cycle, missing periods or kind of a change in lighter periods, or, some of those other symptoms of menopause, perimenopausal symptoms related to lowering levels of estrogen. And, so a lot of times, maybe when things initially start, you sort of chalk it up to other things, but also just, from an age standpoint, menopause can happen really in a broad age range, but, around the age 50 or 51, so for athletes who are sort of following along maybe a more typical curve from a, menstrual standpoint throughout their life, maybe around that age, kind of starting to, if they're starting to notice those symptoms, that may be the starts of something that's helpful.
Yeah. And then what sort of injuries do you start to see related to the changes in menopause and things that kind of come up in clinic?
You can see a lot of the same injuries from lower levels of estrogen and those hormonal changes that you may see in a younger athlete has secondary amenorrhea related to other things. So, you could start to see, certainly we do see bone stress injuries for athletes who are doing a lot of higher impact activity, running, those kinds of things. Bone stress injuries are not unusual. And the other thing to kind of just bringing it to the light and part of the conversation is actually just the realization that some women have eating disorders that may, they may have had as a younger woman. And then sometimes with changes in life and all of that, sometimes it can be a period of time where you can see that again. And so there can be, outside of just the hormonal changes that come physiologically with menopause, just remembering in the back of your mind that it could even be that, an injury could be related to underfueling even in this age group also. So I think that's kind of an important part to remember also. But, bone stress injuries can be common in this age range too.
I actually didn't think about this much with menopause, but I do know from like eating disorder education that I've had, like the transitional periods can be really, really tough. Anytime you can see your body going through changes and trying to fight that change, that's something I didn't think about. So I really appreciate you bringing that up. So physiologically, what is happening? Okay, we talked a little bit about estrogen, but what else goes on that is contributing to how a female athlete might feel as she's going through menopause?
It's really just a transition from kind of the normal monthly fluctuations in all of the reproductive hormones. So estrogen's a big part of that, progesterone, LH, FSH, all of those, a woman's used to having that sort of natural cadence throughout the month. Those are all changing. There are things, it affects women's ability to sleep. Their metabolism changes. They feel like, they gain weight really easily. They may experience, just hot flashes and overall changes with kind of how they're feeling. One thing that's also kind of very important to remember and bring up is some of the, mental health components to it and how whether that's just related to the hormonal changes or also just the transition period in time. But sometimes it's important just to remember that part of it too. And that, that can be just as it is for younger athletes for various reasons. It can be a super important part to remember in treating female athletes who are in this transitional phase of life too.
And I know some of the other things that women in this period of life or on this part of the spectrum have issues with are brain fog because of the changes in hormones, heat regulation. So I know one of the things that I've read a lot about in research is how it's really important to acclimate yourself while in your training, if you're perimenopausal or going through menopause, because you can't dissipate the heat as well. And so you also have to plan for putting cool towels on your body afterwards, make sure you're extra hydrated. There is a lot of discussion, especially with some of Stacy Sims' research about fueling and how fueling changes and how the type of strengthening you're supposed to do changes with menopause. Have you read some of that stuff and gone through all of that? I assumed you, yeah.
Yeah, for sure. And just, like you mentioned, kind of muscle changes and sarcopenia. Yeah, it is a change in mindset, and really understanding that your body is going to be different and what changes do you make to really support yourself and how do we educate people to really support them in continuing to do what they love. And it does kind of require an understanding of what are the changes in your body and what can you do to kind of improve upon, your tolerance of exercise and all of that. So yeah, I agree. All of those things are important really just to kind of have those conversations with people. Because the other thing with menopause too, just sometimes actually working with athletes in this phase of life, I think too, that there's not a lot of conversation is the impression that I get. It's a pretty universal experience for women to go through menopause. And yet, at least from talking with athletes, and we, recently did a musculoskeletal kind of menopause symposium just a couple months ago. And, our feedback really was, an appreciation for having the conversations and starting to do some education, because a lot of women feel like they don't have a chance really to talk about things. And in that way, they don't really have a chance to figure out, well, what works and what should I do and all of that. So I think, even just bringing up the topic and having a chance to say, hey, this is pretty universal. If you're going to stay active, here are some things that are really helpful. Here are some easy changes you could make to your fueling regimen that may really help support you. If you are having, certain symptoms related to the hormonal changes, these are some easy things to do. So I think just bringing it to the forefront, normalizing the conversation, allowing people to ask questions. And I think that goes a long way.
Yeah, I actually had a patient recently that said, oh yeah, once you have a baby and you're postpartum, the whole world forgets about you. I mean, that really hit me hard because I thought, what do you mean we forget about you? And she said, well, nobody talks about menopause or perimenopausal symptoms and nobody knows what to do with us. So, now there's all this conversation around pregnancy and postpartum, but we feel forgotten, or she felt forgotten. And right. I thought that was huge. And that speaks to that psychological component of, transitioning through these stages in life.
Yeah. And, it's particularly with female athletes, recognizing these are very universal experiences. These are not, this is one person that, is going to experience that. Part of the reason why it's super helpful and important to have females in the sports medicine realm, in all realms of providers, and because traditionally these haven't been topics that have been talked about as much, but a lot of women have children. They still want to be able to be active and, have that important part of their life. It can be hard if that's, such a common experience for women, but there's no good way to know, well, how do I go about this safely? How do I return to sort of my previous level of activity safely? And same thing going through menopause. So having women in the field, I think, will really help, just because it won't be forgotten then. It kind of comes up to the forefront, which is good.
One of the things that you said a few minutes ago was there were several tips that came out of this conference that you were part of and helped put on. What are some of those tips that you could share with our listeners? So if you had to give us like 3 or 4 tips for athletes that are going through menopause, what would they be?
So a couple things, the idea of sarcopenia and just the effect on the muscle effect of the changes during menopause. And so really incorporating some kind of weight bearing activity is super helpful. And actually even just a little bit of weight training. It doesn't have to be heavy weights, but some regular weight training can be very helpful, just to kind of maintain that muscle mass. So that's can be a helpful thing to think about. Really also trying to think about maintaining cardio, and from the American Heart Association, about 150 minutes a week of good cardio, supporting heart health, bone health, all of those parts to it. Those are probably important things to remember for any athlete, but kind of as you transition into this time frame, actually making sure that you are doing some good weight bearing exercise, and weight training can be helpful to reincorporate. And then I know you also mentioned before about the idea about, the heat intolerance, and there are some, effects with the hormonal changes. So making sure that you acclimate well, if you are going to be traveling, or say, for example, you're training for a race and it's going to be in a climate that's different than the one you're training in, making sure that you give yourself enough time when you get to the new location to make sure that you're, from a temperature regulation standpoint, have enough time to acclimate is another important thing to remember.
Awesome. And we love strength training, don't we, Kacy?
We do. And, we talk about it like if you're going through menopause, if you're a runner, if you're doing, it's like everyone should strength train.
Right.
Just everyone.
Yeah, it's true. I mean, it really is a different type of, supporting yourself athletically. It's super important. So yeah, I couldn't agree more. It really should be a part of any sort of athletic program.
So I think we're close to wrapping up. What do you think, Kate? Do you have any other questions you want to ask?
You answered all the questions I was hoping to get out of you today, Courtney.
Thank you, guys. Really, it's so nice to have a chance to chat with you.
Yeah.
We've gotten some really good information in this episode. So I'm really, really excited both to re-listen for myself and for our listeners. But Courtney, we finish up with final 3 questions, and these are not as sciencey and hard hitting as our previous questions. These are just so that our listeners get a chance to know our guests and love you guys as much as we love you. So we'll start with our first question, and Kate and I will alternate in asking questions here. But what's one thing that you regularly do to take care of yourself?
That's a good question. I would say I focus on good sleep. I really make a point of trying to get good sleep, go to bed at the same time. Yeah, I feel like that's a good way to make every day good.
God, I couldn't agree more. Sleep is my favorite thing.
Yes.
I mean, other than coffee, of course.
It's a toss
Those are conflicting.
I know they're conflicting.
You don't have to choose one. Yeah.
Thank you. And our second question is, what's bringing you joy right now?
Probably having a chance to spend a lot of time with my nieces and nephews. I have 7 nieces and nephews, all who live in Atlanta, and I see them a lot, and we have a great time. So I really enjoy that.
Oh, that's fun. I didn't realize you had
Awesome.
7.
Yeah, everybody
Wow.
lives here, so it's very cool.
All right, Courtney, last question. What's one thing that you love so much that you just have to do, eat, be a part of? What's an integral part of your life?
You mean like a food that I have to eat or just?
It could be anything, just anything that you really like, you feel like is a staple, whether it's a food or an activity, something that you're a part of.
Okay. I get
It doesn't have to
Okay.
be food.
Gosh, what's an integral part of my life? I'm having to think really hard about this. I mean, I can tell you some things that I enjoy.
Let's do that. That's perfect.
So I enjoy playing tennis. I actually have started to get into gardening a little bit. So nothing too advanced, but yeah, it's been kind of really fun for me. So that's something that I'm thinking more about and may do more of that in the future. But gardening has been something that I've gotten into a little bit. So I would say those are kind of 2 activities that I'm sort of into at the moment.
I might have to ask for some help because I tend to kill all my plants.
It's tough. It's amazing, actually. Like there's a lot of specifics about what does well when and where and all of that stuff. It's much more scientific than I initially realized.
I love my plants too hard. So I overwater them or I over fertilize them. And then I'm like, what happened?
It is such a Kate problem, like just loving something too much.
So yes, here, I'm putting that on the list of things to call you about.
I'll do what I can. I've been to Pikes and had a lot of conversations. I'm not an expert yet, but we'll figure it out together.
That sounds good. Well, thank you so much for coming on today. Again, like Kacy said, I'm so glad you're here. And I think this has been a great conversation. And I really hope that it helps a lot of people.
Thank you. Thanks for having me.
Thank you so much for joining us today. We hope that it resonated with you and that you learned something. If you enjoyed this podcast, please rate and leave us a review wherever you get your podcasts. It really helps increase our visibility within the platform so that more awesome people like you can find us.
If you'd like to support us further, pretty please, you can visit our Patreon page at patreon.com/morethanmiles. That's www.patreon.com/morethanmiles. Or for a few dollars, you can help the show grow and keep going, as well as receive exclusive perks like monthly Q&As with us. Until next time, remember to run the mile you're in, and that training is so much more than miles.